Hello everyone, let me introduce myself. My name is Madison Anglin. I come from a background with extensive healthcare knowledge and experience. This presentation isn't about me or my experiences. It's about an innovation that I believe will affect and benefit the U.S. Let me start with a story about a woman who met an untimely end. Danny was in a severe car accident. She had no medical identification available to emergency room staff, and they had no choice but to follow best practice and go to surgery. They couldn't wait for blood tests to come back, and because of the age of the woman, had no reason to believe she was anything but in perfect health. They took her to surgery, but without adequate health information, she bled out on the operating table. Later staff found out this could have been prevented if only they'd known she was prone to clotting and was recently put on blood thinners. A simple search of past medical histories from a universal database could have prevented this tragic death. The moral, however, is that no such universal database exists, and such accidents happen more often than people like to admit. This leads me to the main point of all of this. The Universal Medical Database would be an asset to the United States, creating a succinct system to minimize the overprescription of medication, organizing and optimizing the access of timely medical histories, and the overall improvement of healthcare. So we ask ourselves, can we fix the system we have to save lives? This leads me into my first point, solving overprescription of all drugs from antibiotics to painkillers. As you can see from the graph, electronic health and medical records are already all over the U.S. These EMRs have the ability to electronically transmit prescriptions, so it's not a question of ability. So we ask, what is it? The answer? These systems don't communicate. They don't track every type of drug and therefore create more opportunities for something called doctor shopping. This is when a patient may see several doctors or facilities to either get multiple meds or get the opinion they wish to hear. With the Universal Medical Database, these possibilities would be reduced significantly. Doctors would be able to see prescriptions and determine if the medication had already been prescribed, how long they last, and if the patient in question has already seen multiple doctors. Moving to my next point, we can thoroughly examine why this records access is significant. Timely records access is important for many reasons. From accurate diagnosis to proper billing, it is all interconnected. Now, as discussed previously, EMRs already exist to varying degrees. However, to access records, the issue is that it takes too long. Not only do patients have to fill out many different forms, depending on location, but usually there's a 7 to 10 day waiting period from my experience. This causes all types of problems and concerns, especially in emergency situations. With the Universal Database, this wait time can be reduced almost instantly. And as for accuracy, transcribing duplicate records can breed discrepancies between facilities. With the new database, this will be eliminated because there is no need to transcribe or summarize anything. Everything all right there at the fingertips of your doctor. Did I mention it will only be accessible to healthcare staff? No single person will be able to merely pull it up on the web. It will be a doctor facility focused database with no patient portal access. This brings me to my third and final point. It will improve the overall healthcare system. With a universal database, better research can be conducted, efficiency of diagnosis will result, and patients will receive better care. As you can see, EMR use is only increasing, so to truly create this system and make it profitable, we begin combining already existing EMRs from those companies who wish to participate. Truly, it would be a refinement rather than a totally new, unprofitable venture. And since the combining of systems will be easier than a total reconstruction, more focus can be placed on the security of the universal system. This results in better cybersecurity and the safety focus. People will consent similarly to the way they consent to use insurance and consent to treatment at the doctor's office. Beginning as a privately funded venture and gradually growing to a national, federal, federally regulated operation. In closing, there are several things I hope you take away from this presentation. I'd like you all to take away the fact that on all levels, meaningful use, e-prescribers, and health information exchange, the implementation of an EMR system resulted in all positive impacts as shown by the green image, each green being a different significance of positive interaction. It's safe to assume implementing a universal system would have the same, if not better, effects. So after everything's said and done, I hope this presentation proved to you that a universal medical database is a solution to some of our current healthcare flaws. This concludes my presentation. Thank you all for your time and consideration.